Hi, I'm Dr. Dan Davidian with Sedation Dental Care. We're going to talk about missing teeth. Many times someone loses a tooth due to a fracture or periodontal disease or some unfortunate situation. And the patient comes to me and asks, how do I replace that tooth? Sometimes it's as simple as doing something removable, but many times people don't want to go through the trouble of having to take something in and out every day. So what we do is we actually put a titanium root replacement into the bone. So we can actually take an implant, put it into the bone, and once that's healed, we can build a crown directly on top of that. The benefit of that is it mimics the natural tooth, restoring tooth function much more effectively. And also something you don't have to take in and out, and that you can floss much and clean much better. You know, we get a lot of patients who come in who have dentures and they're uncomfortable with their dentures. They're rubbing, or they're uncomfortable, they're concerned that they may come out. We can actually take implants and put them, one or two of those in, and actually just snap that denture in. So the patient's not worried about the denture coming out when they're coughing or talking or chewing in a social situation. So we can restore that vibrance or that confidence to these patients who have lost their teeth due to a myriad of different reasons. When you talk about missing teeth, you know, you have the single tooth, you have the patient who has dentures and just wants to have the confidence that they're snapped in and they're not coming out and they chew well. And then we have the patient who doesn't want to take anything out and wants to just have a full new complement of teeth. And so there are procedures called implant supported prostheses that allows us to truly, literally replace all of the teeth and have something that doesn't come in and out, that doesn't cover the roof of the mouth. The benefit of that is a lot of patients who have dentures or have missing teeth, they complain about not, when they drink their coffee, the roof of their mouth, they can't, feel that the heat or cold. They just feel like there's a fullness in their mouth. There's just a lot in there. They're high gaggers. So those are circumstances where we look to the implant supported or implant retained type prosthesis that just comes in and out. Maybe once a year they'll come in, we'll check the prosthesis, and sometimes we'll take it out and clean it. Many times those teeth that are put into multiple implants that we don't remove, the patients walk around like it's their own teeth each and every day, and they forget they don't have teeth. So most people ask, what's the process for implants? On some cases where it's a front tooth and the bone is healthy enough, we can put the implant and crown in the same day. Many patients come in, they'll get the implant in one day. They'll either get the tooth out, and a lot of times we can put the implant in that day, but generally they heal for about 3 to 4 months, up to 6 months depending on the circumstances, and then we'll put the crown on top of that. If it's implant supported, where we're putting all the teeth in, we can place all the implants and place the teeth the same day. If it's implant retained, where you have a denture that just snaps in, there's a healing phase where those implants have to heal for a period of time before they can actually be snapped in. So the implant supported is much more natural option, feels much more natural than a full denture. So it's kind of the next level over implant retained. So implant retained means it snaps in, implant supported means it doesn't come out. So the implant supported is, a lot of people call it all on 4 or all on 6, and that's where it is screwed in. Some patients will come in, have the teeth that they need extracted, implants placed, and the implant supported thing will be screwed in that same day, and we won't take that out until they're fully healed. Once they're fully healed, we'll take that out, check the implants, and then we'll make another permanent prosthesis that fits on there that they'll only have to have checked, say, once a year to make sure it's still stable and clean. So with the implant supported, the non-removable teeth, the recovery time varies, but usually it's a day or so of some minor discomfort. We take great care in being able to support the patient and keep them comfortable through the whole procedure. So with today's technology, it allows us to replace a single tooth all the way through a full complement of teeth. So it's as simple as coming in and having a consult so we can evaluate what fits your needs and your budget.